and welcome to Brewing Brilliance, a podcast where we talk to academics from across the university who are involved with the Healthy Ageing and Chronic Conditions Research Institute. We will be speaking to researchers who are leading innovative interdisciplinary approaches to promote lifelong health, delivering improved interventions to manage chronic conditions more efficiently. These sessions are essentially opportunities for us within the Healthy Ageing and Chronic Conditions Research Institute to meet colleagues from across and beyond our faculty to foster knowledge sharing, collaboration and networking. Today, I am joined by Dr. Kate Ellis Davies, who is a psychologist focused on the study of mental health, wellbeing and development across the lifespan. This includes the transition to parenting, the transition to school, university, menopause, retirement and transitions in health. Kate's research is applied and interdisciplinary, working with the third sector and collaborators across fields of psychology, anthropology, data science, sociology and public health in order to develop the strongest evidence base to support policy and practice. Building on her research, Kate is the chair of the Interdisciplinary Perinatal Mental Health Group and the Student Wellbeing and Outcomes Research Group, while being the Programme Director for Psychology undergraduate programmes at Swansea University and the lead of the new Centre for Applied Reviews in Evidence. So hello, welcome and thank you for joining us. There's so much going on in your area, so I'm going to start with a nice easy question.
Great.
What was it that made you interested in both health and developmental psychology?
So my interest in psychology, I would say, probably started when I was about 8. And I knew someone who was going to go see an education psychologist. And I was a really endlessly curious kid. And I thought, well, I've never heard that term before. What's that? And someone described it as, they work with teachers and parents and children and make sure that they have everything in place so they can learn the best they can and they do well and are feeling well and good when they're in school. And I thought, that's great, I'll do that. And I kind of stuck with that idea of that's what I would go into until I was in Cardiff doing my degree, and developmental psychology just caught my interest because this idea of you study change over time was just thrilling to me, because I thought, well, we're never not changing.
Yeah.
So if you get that as your area, you can dive into it, try and understand it, and then apply it across the whole of your life. And I thought that will be endlessly fascinating. And it enabled me to capture my interests across a lot of different disciplines. I didn't like the idea of becoming a specialist in one thing and being really myopic and thinking, well, I'm only going to study this particular behaviour in this particular experiment. I liked the idea of learning from anthropology and sociology and human sciences in general and geography and data science. I thought, what can all of these things bring to the questions I've got? And change over time and change over the lifespan really allowed me to dig into that.
And is that why you sort of honed in on the change across the lifespan then?
Yeah.
Because it was just...
Yeah, and I thought, for me, when I'm looking at change over time, I want to understand, are all the life transitions that I think of the same as what you might think of in hunter-gatherer societies or different cultural groups? Is there some universality in what we consider a life transition or not? And beyond that, how do people experience those life transitions? What sets you up nicely to be able to manage those, cope with those? And what makes things a real challenge for those life transitions? And if you can understand how that works in one life transition, does that translate to others? So really, it's trying to get as big a bang for your buck. If you've got a nice, solid evidence base for understanding a life transition, does that help you understand different life transitions across the bigger lifespan?
And that's how you sort of look at it, because like you said, you start with the health and the developmental psychology, and then it sort of moves right the way through to menopause and women's health and things
beyond.
like that.
Yeah, absolutely. And I think for me, the thing that's always drawn me to the developmental side, above and beyond just thinking about change over time, is how many different actors are at play in that scenario. Obviously, there's a developing child, but you can't only look at that child. You must look beyond that. To this lovely quote of, there is no such thing as a child. There is always a child and. So you must look at the caregivers, the family environment, the societal factors around that, if you want to get a handle on how that change happens for that child.
So would you say that sort of shaped where you look at the early experiences then of the child and like the outcomes that maybe shape their life?
Absolutely. So that shaped my idea of who we think of as the caregivers.
Yeah.
Is that really the entirety of that system or that family system, we refer to it? Or are we quite limited, and are we ignoring big parts of that system, and then therefore limiting how good we have as an understanding of what's going on, and also making sure that we take care of those people that are the caregivers. And they are important in their own right, and their well-being is important in their own right, but understanding what an impactful role they have on children for the short and the long term really puts a good amount of emphasis on how effective and efficient it is to provide support for those family systems if you want really good long-term outcomes for everyone involved.
So, like when you're looking at the parent and child relationship, have you been able to sort of look at the predictive factors of how these outcomes might, you talked a bit before about the big personality test and looking at predictive factors. Are you able to tell us a bit about?
So I was exceptionally lucky after I finished my PhD to go and work with Professor Michael Lamb at the University of Cambridge, who was the head of the Applied Developmental Psychology Research Group there, alongside Susan Gollenbach, who was the head of the Centre for Family Research at Cambridge. And that was a massive European project that I was involved with colleagues, so Alice Stanley, as well as fantastic Dutch and French colleagues as well. And we were looking at what are the factors that are important for looking at things like parent mental health, the experience of that transition to parenting quality, very early parenting behaviours, and how that relates to later attachment and those kinds of things. And we looked at family groups that were formed by assisted reproduction technologies. They were all planned families. And in the sphere of looking at what predicts that transition to parenting, there's a lot of discussion around does the being planned pregnancies versus not have an impact. So we looked at a group that were entirely planned. Now, you can ask parents retrospectively, once they've had a kid, was that child planned or not? There is some social pressure there.
Yeah.
So it's quite difficult to get at that sometimes. But if you're looking at families that have all been formed by assisted reproduction technologies, they were planned.
Yeah.
And then the other aspect of it is we wanted to untangle this theoretical question around the roles of gender, the roles of caregiving role, the biological link between parents and children. So we had gay parents that were parents through surrogacy. We had lesbian mums who were parenting. That path to parenting was from donor insemination. And we had heterosexual parents who had parented through IVF. So we could disentangle all of that. And what was really important there is that these are real families, and these are real families that are formed using these technologies. And it's really important to include them in the field of research, that policies, legislation, provisions and information resources are going to be affecting them. And on top of that as well, there's a real theoretical question there. If you don't look at parents that vary in gender and biological relatedness and their caregiving roles, then you can come to some really solid looking conclusions around the role of gender and caregiving role. But if you aren't looking at families where a dad is doing all the dominant caregiving role, and looking at does that look similar, you don't get at that theoretical question.
Yeah.
So yeah.
Was it influenced? Was it nice actually having the Dutch and the French colleagues as well? Did that sort of help shape?
It was absolutely phenomenal. Yeah, it was really a great. And again, that was bringing different disciplines. So we had definitely psychology was in there, but we also had sociology coming in there as a really strong discipline as well. And understanding the context in which you become a parent and the society that you're within really shapes that transition and that experience of that transition as well.
You mentioned at the start of this about change over time. Do you think, have you seen lots of big changes in how we perceive that sort of change over time while you've been looking at it?
Absolutely. And I think even if you take the transition to parenting, for example, the advice that used to be given to women when they became pregnant was don't exercise. You don't want to upset the pregnancy, treat yourself very fragilely. And again, that had real societal and economic variation to it. There's a big swathe of society that would never have been able to follow that advice. They had to be working really physical jobs. But then the advice changed, and it was, well, you can do some light exercise, but nothing heavy, and be very, very careful with yourself still. And now the advice is if you're very active prior to pregnancy, carry on unless you have some particular concern, you discuss that with your medical team. So that's really changed. And then if you take that to women transitioning and through perimenopause and menopause, We now know that strength training is this fantastic way of supporting women's health through that transition and decades afterwards as well.
And it's funny how sort of social media and other sort of things influence that as well, don't they? Because they sort of encourage this sort of thing. Do you think that's had a significant change on how people view things, or?
I think social media has impacted everything.
Yeah, that's true. Silly question, really, wasn't it?
No, not silly at all. We don't want to discard that impact. I think it's really important that we don't push it to the side. There are many women that I speak to who have said, well, they were really curious about this and they didn't know where to go through traditional sources of information. So they didn't know, their midwives weren't aware of this and their obstetricians didn't really have that much information. So they go to social media. So I think if we are researchers trying to create an evidence base for evidence-based policy and practice, we need to meet people where they are and have those discussions with them for sure.
Yeah, because they're a huge part of what your research is all about, isn't it? Because it's how they're going to utilise it. It's all well and good embedding something in policy and practice, but it needs to work for them too.
Yeah, and I think it needs to make sure that we're touching on the people that are going to be using this, and that might be the parents, it might be the people caring for those parents as well. There isn't much point in me creating an evidence base that the public find out about if we haven't then given that support and training to healthcare professionals.
Yeah. And that was one of the things in terms of parents and caregivers. What role do they play in shaping their children and how they manage life transitions? And I guess that could influence that as well, couldn't it?
Yeah. And I think I really love is that across my projects, certain researchers might think that they're not looking at life transitions. They're like, no, I'm a perinatal mental health researcher. And they are, and they're fantastic at it. But their work is so relevant to the transition to school. It's so relevant to the transition to university and all those other life transitions as well. But that's not necessarily how everything has been framed. And one thing we know, and it's not talked about so much as a life transition, but I really view it is this transition to school as a huge change for children and parents as well. And we know from fantastic research by Nancy Eisenberg that parents have this really pivotal role in supporting children's pro-social development. And that set of pro-social skills, so sharing, collaboration, empathy, are all things that can be fostered by parenting quality and allowing your children to have a situation where they're developing good emotional regulation, that they are modelling empathy and they're picking up on those cues as well to show emotional states in others and themselves.
Did you notice, I don't know if I'm going to be sort of using the C word quite naughtily here, but did you notice massive changes through the COVID and how that influenced?
Yeah, we're seeing them now. So one of the projects we've got going on, Amelia, who's a fantastic master's student of mine, is looking at the moment on school readiness. So school readiness is this set of skills that allows you to adapt into transition to school for kids. And they're not necessarily just purely thinking about your numeracy and literacy skills. Of course, those really help. But also, can you feed yourself? Can you dress yourself? Do you still use nappies or are you using the toilet? Can you get on with your peers? Can you handle when a kid isn't sharing a toy with you? What do you do in that situation? And what we're seeing is the tranche of kids that are starting school this year, those were the kids born during 2020. And their school readiness is not where we would expect it to be. So teachers are reporting that, parents are reporting that, observationally we're seeing it as well. And you don't have kids with the school readiness skills that we would need them to have. Teachers have a really hard time having their attention focus on teaching and learning with those kids when there's an awful lot of other skills they're trying to bring those kids up to as well. And
that was almost a huge societal thing, wasn't it, that influenced the development of children?
Absolutely. So we were really worried during the start of the pandemic that we would see a big rise in preterm birth because there were several things going on that could have contributed, and theoretically we know those things are associated with preterm birth. So we were concerned about the impact it would have on perinatal mental health. We were concerned about the access to maternity services, and those were really preserved as much as they could be, but they were definitely altered. And then post-birth, we were really concerned about the impact it would have on support systems that families really rely on, both familial, peer, and also in terms of health visiting, all that kind of work as well.
And you touched on one of the key buzzwords there as well, mental health. What do you think? How does that sort of influence the outcomes in later life when you're having to deal with stress and mental health from such a young age, I guess?
So we can see the impacts on stress and mental health on development before kids are born. So I kind of alluded to it before, but there's some good evidence about the impacts that stress and anxiety have, for example, on birth outcomes. So there's an association there between stress and anxiety and preterm birth. So we really want to make sure we're supporting parents and their mental health. Preterm birth is still the leading cause of infant mortality and morbidity for children up to the age of 5. And research that we did with the big personality test really showed lifelong impacts of preterm birth on life satisfaction and job satisfaction, and impacting those aspects of well-being that affect people's transitions through different stages of their life. So we know that the parents' mental health, and less has been done on paternal mental health. We're really working to address that. But we know parental mental health has an impact before children are even born. And then once they're born, perinatal mental health is still one of the leading causes of maternal death by suicide in this country.
It's fascinating to think, because you can be premature, you could be, but you don't necessarily think when you have a premature baby where they will be, or what influence that will have on their lifespan. And like you said at the very beginning, it's across the lifespan.
Yeah. And we also want to be really making sure that we're careful in not being fatalistic as well. So there is exceptional changes that have happened in the care of preterm babies.
Yeah.
So the medical advances, just having an incubator, having surfactant, which allows the lungs to be functioning in a better way, has vastly improved survival rates for babies born preterm. So we don't ever want to diminish the possibility of children that are born preterm.
Yeah.
We definitely don't want to diminish the challenges that those families face either, and making sure we're reducing the rates of preterm birth and we're reducing the impacts of preterm birth on the whole family's well-being as well.
But it's about eliminating it as well, isn't it? If you know it's there, you can almost pre-plan for things, can't you? Because you know what to look out for, and you can just make that life. It makes me laugh that you don't always think about that small one thing that can happen as a young child and how you handle it. Like you were talking about emotional regulations and the impact that can have through all those different transitional life stages. And like you said, we all go through.
Yeah. And even if you think those skills of being able to interact with others, that was really tested during the pandemic.
Yeah.
But we know that as we age, those that do well, those that are functional and have a good level of health as they age, are the ones that are keeping up social interactions. They're the ones that are staying active as well. And having no support with those skills and then getting to 70, 80 and being like, well, now I better get some social skills. That's a big ask.
Yeah.
But if we can foster that throughout the lifespan, then that serves you well and everyone around you.
And it's thinking as well, isn't it? Like you hear a lot at the moment about people getting diagnosed with certain things later on, and they're they're talking quite openly about the impact that it did have, and they wish they'd known sooner, because you can figure out other ways of helping you achieve what you want to achieve through those transitional stages.
Yeah, I definitely think that knowing thyself, I think as a species we are intrigued by that.
Yeah.
Understanding yourself, and that you will change over time. And who you were is not who you are today, or who you will be tomorrow.
Yeah, I haven't thought of it like that, but it's amazing to think of it like that. Are you able to tell us about any of the projects you're working on at the moment?
Absolutely. So I have a fantastic PhD student called Lucy Owen, who's doing a project on trying to be proactive about student mental health. So looking at that transition to mental health, taking the model we've got from perinatal mental health and thinking about what are the things that can either exacerbate or support that transition, and see if those same things can support transition to university. So we really want to address areas like intolerance, uncertainty. So everything is uncertain at certain points in life, and life transitions are a big peak point for uncertainty. We can't remove that either from the transition to parenting or the transition to university, but we can support people in being more comfortable with that uncertainty and working through it. So one of the interventions we're looking at is we're doing a randomized controlled trial feasibility study at the moment using Prevail. So my collaborators, Nicola Gray and Bob Snowden, developed this proactive public health approach. So rather than waiting until people are in crisis, giving them some skills, regardless of what position they're in, and seeing what that does in the work setting. It worked really well in the work setting. So now we're applying it to a university setting. So Lucy's going to be applying that to undergraduate students, postgraduate students, and university staff as well. So that's one lovely project. Another fantastic PhD student.
We've got a list.
Yes, they are all amazing. Is Lucy Perry, and taking on that idea of what we were worried about during the pandemic with rising preterm birth rates, to a vast degree didn't happen. So globally, internationally, we saw many instances in countries where there was a drop in preterm birth rate during the pandemic, and then it picked up again post lockdowns. And that was a real head scratcher. And a lot of us started thinking what might have been bringing down preterm birth rates, even though perinatal mental health concerns were going up, even though there was things affecting access to care. And pollution was one of the things that we've landed on there. We are really exceptionally lucky in Wales that we have the SAIL data bank, which has an amazing array of data on geographical area, pollutions and health outcomes. So Lucy Perry's PhD, along with Rich Fry and Amy Meisen and Amy Isham, we are looking at tracking pollution and its effects on perinatal mental health and preterm birth and birth outcomes in general, before the pandemic, during the pandemic, and afterwards as well. So that's one of those projects.
What I like about that one is it wasn't necessarily something that you thought, because it's come out of something different, hasn't it? You know, it was unexpected.
And I think you should always be testing your theories. And when life at a mass scale challenges what you thought was going to happen, that should cause you to pause and look at other disciplines or other researchers or other theories that are going on and go, something might be having more an impact than I thought it was going to be having. And there's been a long line of research showing the impact of air pollution is not good for pregnancies, and just living one street back from a main street reduces your preterm birth risk. But this was at a national scale, and significant changes in air pollution very quickly. So this is this natural experiment going on. And one of the other projects we've got going on is I've worked really hard to try and provide evidence bases, to have evidence-based policy and practice outside of universities. But there's a real challenge in making sure that our teaching is evidence-based as well. And because I'm programme director of our psychology degrees here, it's given me a really lovely opportunity to see where we had gaps in that. And one thing we're doing is we applied the testing effect, where you test information as soon as you learn it. It helps your learning and memory. And we showed that doing that in every single lecture supported students' mental health. They were less anxious about going to lectures. They found it more engaging. They were more likely to go. They felt like they were more likely to say they were getting the feedback they needed as well. And lecturers were telling us that it let them know when students weren't aware of what they needed to pick up on at the end of the lecture. So now about 20 universities picking that up.
And it sort of ties in nicely with what you were talking about one of your first projects as well, and supporting that student mental health program.
Yeah.
And it's just how they all intertwine, and it's exciting.
Yes. I think, if you look at my stuff, I think that trying to get a handle on what's impacting mental health at different stages. And sometimes it's really, you can go, well, this worked in this life transition. I think let's see if it works across this one as well. And there's going to be some really areas of great fit there. Yeah. And if there's not, then that's really interesting. It's intriguing.
Yeah. And it's like you said, with the birth in COVID, you were expecting it to do something, but it didn't. So if this model isn't working here, why isn't it working? I love the sort of curiosity nature behind it. Yes.
And I think any time someone's asking me about the career of going into academic research, or in psychology in particular, for example, it's just this: do you love curiosity? Does it drive you? Do you always have questions? And are you comfortable with going, I don't know? Like, everything I've known up to now doesn't explain this thing. I better go and find some data that will allow me to get more of a handle on this.
But evolving as well, because there's so much, like we've talked about already, globally, nationally, societally, you know, all these changes are influencing what we predicted could be an outcome.
Yeah. I mean, I would be the height of a hypocrite if I was focused on change over time or went, no,
we don't change.
I'm going to stick with my positions forever. Yes.
You have got such interesting topics here that are going on, and I could literally talk to you for so much longer. I think I'm going to have to pinch some of your research students to come in and chat with us as well.
Please do. They are amazing. Yeah.
But thank you so much for coming in to talk to us. I've really enjoyed listening to this change over time, and it's really fascinating to hear. And it's really nice to get that research perspective on it as well.
No worries at all.
If people are interested and want to find out more, can they reach out to you?
Absolutely. Yeah? So they can find me on the Interdisciplinary Perinatal Mental Health group. So that's the Perinatal Mental Health Matters website. Or they can always find me via email or LinkedIn. And we have our school YouTube channel as well.
That's amazing. Thank you so much for coming
in.
Much. If you have enjoyed what we've talked about today and you want to find out more about Kate's work or about this podcast, then please visit Swansea University Research. We are the Healthy Ageing and Chronic Conditions Research Institute. Thank you once again for coming in.